Some world leaders have been praised for their handling of the crisis, like the leader of New Zealand, whilst leaders in Brazil and the US have been accused of setting poor examples. The World Health Organization has been accused for failures as well. It's had to admit now that its advice around droplets may not be correct because COVID-19 may be airborne. This is, of course, a new virus leading to multiple crises for leaders trying to grapple with it. So how are we doing in South Africa? Already the President has admitted there have been contradictions in government's response. There are also questions being asked about how well South Africa used the lockdown initially to prepare for what we're dealing with now. In June, the President announced a further opening up of the economy, but leaders in Gauteng, other provinces, have suggested that stricter enforcement or even harder lockdown measures may be better, adding to uncertainty right now. Before the President speaks tonight, we're joined by independent political analyst Sandile Swana. Mr. Swana, thank you for being with us. Can we first accept that no one is going to manage this crisis perfectly? And the President is pulled in so many different directions. So you've got the economists saying open things up, health people saying something different, the National Command Council involved, provincial leaders putting pressure. There may be party pressure as well. How would you say he's navigated all these pressures pulling him in different directions thus far?
Thank you so much, Francis. I think that we need to look at the results that, as Ridwan was analyzing them, we have to give credit to the team that has been helping us with COVID-19 in South Africa. We are far below the death rate internationally. The death rate internationally is about 4%. South Africa is about 1.5%. The death rate in Great Britain, for instance, is 15%, whereas in South Africa is 1.5%, which means the British are at almost 10 times the rate in South Africa. Yeah. So for a start, we have to just say that our team in South Africa has done, whether by accident or whatever it is that you want to attribute it to, the results, if we just take the results, we've done well.
Okay, so you're saying that could be due to leadership, not just because of something generic to South Africa?
I think that the steps that have been taken, there are things, many of us have changed our behavior. There's no question about it. The lockdown has had effects. So those things, we must criticize government when necessary, but we must also look at the results. My analysis would say that for now, up to this point, the interventions have worked in favor of South Africa. Our statistics are looking good. Yeah. But having said that, the question that is being raised now is that we knew that this exponential growth, you're talking about doubling every 14 to 16 days, depending whether it's the death rate or the infection rate, whether in fact we have managed that well. And to me, that is where the leadership, Cyril Ramaphosa's leadership and his team is going to be tested. Because all that is about, it's about altering the behavior of South Africans. It puzzles me indeed that the Eastern Cape is in contention with Gauteng and Western Cape and KZN for a top spot in the number of infections and deaths and so on, when it is actually absolutely a poor rural province. Somebody needs to look there as to what are the behavioral issues there. Is the leadership within that province actually leading the people in the right direction? Yeah. Otherwise, the nation as a whole is being led relatively.
What about different leaders saying different things? So we have an opening up of the economy, then we have some provincial leaders suggesting they want something harder. Imagine being a restaurant owner, you've just opened up. Now there's uncertainty about whether the economy will stay open. Is that a real problem for you or something that really can't be helped? We're running a democracy in South Africa, so there are going to be many voices and many contradictions. But when you look at the pattern across Africa and even across the third world,
the question of a hard lockdown does not arise at all. I mean, if you look at the number of poor people, people who live below the poverty line in South Africa, it's larger than the population of Mozambique at above 31 million people. So those people have to look for food physically every day all over the show, and we don't have the money to tell them to go and stay at home and give them adequate and sufficient food. Secondly, our infrastructure, Africa as a whole, including South Africa, the bulk of our people live in shacks, 9 square meters and things like that. So the issue of isolation at home and so on, and sanitation, etc., is a big challenge. We are a third world country in the true sense, and we need to accept that. So the economy has got to be open to give people the chance to go out there and make a living. However, where we are lacking in terms of leadership is that maybe our people are not being guided, even emotionally, to their commitment, where everybody is totally committed to being absolutely safe to the best of their ability. That is lacking, and I think the Eastern Cape is probably an example of that lack of discipline.
Yeah. And you've spoke about a democracy. Some have criticized the president for not taking questions from journalists, because this is a democracy, for not being challenged. He also spoke about a month ago, if you look at these major addresses. Is that enough?
I think that personally, I have been calling for the president to give the specialists in these disciplines a chance to speak about the issues that they know best. I'm glad that even you yourselves invited the CSIR to come and educate all of us about the details and nitty-gritty. It doesn't help for a person to be speaking generalities. The last time we spoke here, Trump was being used as an example, and in many ways you find that Trump has been a disaster, talking about things he knows nothing about. And I think once as Cyril Ramaphosa, our president, is clear about the broad leadership issues, he can make brief statements about those issues. The people who know what must be done technically and get the job done and save lives are the ones who must clarify to us how we can save our lives, because we as citizens are the ones who need to be informed and educated daily about what to do to save our own lives in this whole situation.
Yeah.
And President Ramaphosa needs to stand behind those professionals and give them a chance to speak accurately, scientifically, and guide us.
So talking about the scientific evidence, I mean, the health rationale was there right in the beginning, and the president said we had to flatten the curve. Now, that was all about controlling infections and when the peak would come. If you think about it now, alcohol, that's about beds, availability of beds, tobacco as well. The minister's talking about ventilators. So the rationale has changed along the way. Is that problematic for you? Does it seem haphazard, or is that bound to happen? Is that okay?
Again, you must remember that all these groups, they are lobbies on both sides of the coin. Fortunately, in the cabinet, we have some doctors, medical doctors, but at the same time, you have a business lobby. The lobby for alcohol, for instance, the sales of alcohol, there is evidence. Even some of the economists, I think, I can't remember, it was Azar Jamin speaking, who said that actually the number of beds that are being demanded by people who are injured as a result of alcohol and so on is actually increasing, obstructing now the healthcare issue. Whilst people want to make money out of alcohol, this thing is creating serious health problems, immediate health problems. And we know that our GDP and our national budget is under a disease burden caused by alcohol and cigarettes, two separate ones. I think, if I remember the figures correctly, about 5% each is of the budget, of our health budget, etc., etc., etc. So all those things need to be factored into this, and to say that, are we going to allow alcohol to continue in an uncontrolled fashion? It may well be that tonight a different voice might come and say we're curtailing alcohol sales and consumption from this point going forward, because those beds that they are demanding in the hospitals are much needed by other people.
Yeah, certainly speculation is rife that the president could change at least those alcohol selling hours, for example. That was political analyst Sandile Swana. Thank you very much for your time. Let's take a look.